Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker. Thank you for tuning in. Go ahead, spread the word. You know what's happening. Let everyone know A Healthier Tomorrow is on the air. Today's guest is none other than Dr. Christina Madison. She is passionate about the health of our community and one of the most knowledgeable people in Nevada. You've got to hear her. A Healthier Tomorrow is an outreach program of Community Partners for Better Health. Visit us online at our new web address, cpbhlv.org. That's cpbhlv.org. The mission of Community Partners for Better Health is to empower people and the community with the necessary knowledge and tools to improve health, quality of life, and eliminate health disparities. Thank you for tuning into our program and for helping us to fulfill this vital mission. I also want to extend a very special thank you to the Southern Nevada Health District. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Southern Nevada Health District is working with other partners to respond to the COVID-19 pandemic right here in our community. For more information about COVID-19, available community resources, or for information about testing and vaccination, please visit the Health District's website, www.southernnevadahealthdistrict.org, or call the information line at 702-759-INFO. Again, 702-759-INFO. All right, so let's dive into today's show and get you the information you need about COVID-19. Well, good morning and welcome to the show, Dr. Christina Madison.
Thank you so much again for having me today, Will. It's a pleasure and an honor, and thank you again for all that you do for the community.
Oh, yeah, it's a joy. And to serve with someone like yourself is amazing. So for those listening, I've had the absolute privilege and pleasure to spend quite a few hours on webinars with this fantastic wealth of knowledge over the past probably 6 months at this point, talking about our subject for this morning's broadcast, which is COVID-19. So Dr. Madison, if you would just let our listening audience know your background and why you are speaking on this subject today.
Absolutely. So as a Nevada native, I have a passion for caring for the underserved in our community. I have been an associate professor of pharmacy practice with Roseman University of Health Sciences for the past 14 years, and a giant chunk of my professional career has been spent working in public health. And because of that, I created a consulting business called the Public Health Pharmacist, because I just felt that it was so important to prioritize public health and pharmacists working in public health to be able to create healthier and happier communities. And obviously with the COVID-19 pandemic, we have seen a greater emphasis on public health and why it matters so much, and ultimately why specifically public health messaging and that getting to the public in a way that is easily understandable is so important, and in some cases potentially could be deadly. As you know, and I know, in the month of June, we had 10,000 deaths related to COVID-19 that were completely preventable if people had become vaccinated. And so my goal is really to educate people so that they can make an informed decision about whether or not vaccination is right for them, but ultimately really getting at the heart of why access and health disparities are often the cause of why people may not get vaccinated, and not specifically the fact that they may be hesitant because of what they read on social media this week.
Yeah, wow, what a way of introduction. I love just the information outpour. But something you mentioned in there, I don't think I knew. So you've been at Roseman University of Health Sciences. That's a long name, but you've been there 14 years?
Yes, I started there in August of 2007. So I'm about to hit my 14th year.
Oh, my stars. Well, congratulations on that anniversary.
Absolutely. Yeah. I really had the honor and the privilege to start off my clinical practice with the Southern Nevada Health District. So I was the clinical pharmacist for the health department for about a decade before I transitioned to my current role, which is that I'm the clinical pharmacist for Huntridge Family Clinic, and we cater to the LGBTQ community and are one of the largest providers of HIV prevention and gender affirming care in the state. So again, I think really the common thread for me as a professional is sort of my call for service and care for others, but ultimately to really be able to provide access to care, and not just care, but quality care for the underserved and the most vulnerable of our population.
Yeah, and so just we understand what pharmacist is. I'll admit, before I got into the profession, I thought it was just a person at CVS to just put my pills in the container and that was it. Can you help our audience understand what exactly your role is and the type of education and training you've had to have to fill this spot?
Absolutely. So, in addition to going into obviously a science based degree in undergrad, I went to pharmacy school, which is actually a doctoral program. So, every pharmacist that graduates from a college of pharmacy graduates with a doctor of pharmacy degree. I'm also residency trained. So, they're typically what we call clinical pharmacists. So, pharmacists that typically engage in what we call direct patient care, meaning that they're not in a pharmacy counting pills necessarily, but they're actually providing direct patient care. So, in that regard, I did what's called a general pharmacy practice residency, which just meant that I was able to help patients in a variety of different disciplines. I was lucky enough to have a residency at a VA in Albuquerque, New Mexico. So I trained there for a year. I did everything from oncology to wound care to infectious disease, and also provided care in mental health. And so it was just an amazing experience. And then when I finished my residency, I was able to move back to Las Vegas since I am a local. And I actually taught for Toro, which is the medical school, one of two medical schools we have here, for a couple of years. So I started their medical pharmacology department, but I really missed direct patient care. And so that's when I ended up working for Roseman and took the what we call practice position, meaning that the pharmacist doesn't just teach in the classroom, but actually sees patients in a clinic. And so I took that role on and worked at the health department. And so it was really just an amazing experience, because not only was I able to provide things like vaccinations, but I also helped with the family planning clinic with contraception. I also saw patients, a lot of immigrants and refugees, for tuberculosis, as well as HIV and STDs. So it really was just, a plethora of different disciplines that I was exposed to. I even did disaster preparedness. So I really helped out and was able to, be on the ground for the last pandemic we had, which was H1N1. So I think that really helped me to prepare for COVID-19, because we had done all of those mass vaccination clinics in 2009 for H1N1 when we were worried about pandemic flu.
Yeah, yeah. Wow. So well-rounded, lots of experience. And you said the V word a couple times in there, which is what we're going to talk about here. So now we're still in the midst of the COVID-19 pandemic. I understand I was on the strip this weekend, so I know it feels as if we're back to quote unquote normal. But the reality is the science shows we are simply not there yet. And as you mentioned, we've lost far too many people to this disease just in the past month because they were not vaccinated. And so, if you don't mind, could you just share really quick how the vaccine was developed and address some of those very legitimate concerns about why people may not have taken the vaccine just yet?
Absolutely. So this is something that I talk about with patients all the time, because there is this perception, especially within the media, that the vaccine itself was rushed, right? And so the one thing I want people to understand is that, this was a once in a lifetime, unprecedented effort where not only did we have the political will in order to get this vaccine to market, but we also had the global community and the financial means in order to get it done. And so it was all of those things combined, and the fact that this is a global pandemic, that literally everyone in the world was working on one single goal, and that goal was to get a vaccine that was safe and effective to prevent hospitalization and death associated with COVID-19. And so when we talk about the development, I think a lot of people don't understand that the messenger RNA vaccine, which I like to call the Snapchat of vaccinations.
I love it.
It basically just goes to your cells, shows your immune system a picture, and then disappears, right? So it doesn't go into your DNA, it doesn't change you, right? It really literally is just like a Snapchat. And because of that, and because of the research that was done in the past, we really took that like almost 2 decades of research that was being placed in messenger RNA technology, which, by the way, isn't novel in other areas of medicine. So it was already being used in things like oncology. We also know that there was a messenger RNA vaccine that was developed for things like Ebola, which was another epidemic, right? And so this thought process that this was such a brand new concept and that it just came out of nowhere really isn't accurate. We really did base this on the science. And because of the fact that we had the financial ability as well as the scientific community as a whole coming together for this one single purpose, that's really what drove this, as well as the fact that when you think about the typical development process where we have phase 1, phase 2, and phase 3 trials, typically those are done independently and sequentially in time. So it increases the amount of time it takes from the time that, say, the virus is identified from the time you have a vaccine that's available. Because we were able to combine steps and do things simultaneously, it really cut down the amount of time it took for us to go from concept to viable vaccine.
So we had the resources and the researchers convene worldwide to really adopt something that's already been in use for this targeted effort.
Absolutely. And I love the way you said that. We had the resources and we had the research, right? Both of those things combined help us to get to this moment in time. And I'll tell you, vaccines in general have already been a modern miracle. But the fact that these vaccines are so highly effective, it is literally, one of these things that for us that work in public health is sort of like our Super Bowl, right? Like, talk about just amazing, interventions and the results that we got from these trials. We were just astounded. And again, time and time again, the data is boring that out, right? The fact that 99.5% of people that we know that have been hospitalized and died in the last few months from COVID have all been unvaccinated. I mean, if the vaccine wasn't that effective, we would not be seeing those kinds of results. We would not be seeing that kind of data.
Yeah, the sad proof that we have in that. I was on Instagram, put another social media plug out there, and a video was made by a content creator and just kind of poking fun at CDs and saying, oh, you're still using CDs, not talking about streaming services or TikTok or these new things that are out there. But kids nowadays take for granted the fact you just play a song. They don't know about having to actually go and purchase a physical item and have something to play it on. It's all in one thing. And I think we're the same now with vaccines, but we've forgotten why they exist and how much of a miracle they really are. And sometimes we forget like the things we just get vaccinated against as youth. We don't even think about the consequences of what that disease or virus does because we've had vaccines for so long now and we're just accustomed. So thank you for making that crystal clear for us. Can you share a bit about the new variants and how the vaccines are dealing with like the Delta variant? It's the most common right now.
Yeah, absolutely. So just to let you know, the term variant just means a mutated virus. So in general, when we think about viruses, that's what they like to do, right? So they want to change, they want to outsmart the immune system, they want to outsmart vaccines, they want to outsmart medications. Why? Because they want to survive. Right. And so the only way for them to do that is to continue to have a host to replicate and to continue to transmit to more and more people. And so the reason why we're having this issue around variants is because we are continuing to provide the virus with new hosts in which to replicate and change and outsmart our immune system and potentially outsmart these extremely effective vaccines. And so I think the biggest one that people probably remember before the Delta variant was the UK variant. So that's our beta variant. So we've got alpha, beta, delta, and we actually even have lambda now too. And so really what this is just, it's another way for us to talk about a virus that has mutated and changed. And in particular, we are so concerned about this Delta variant, which originated in India. And I don't know if you saw, the devastation in India and just, millions of people dying, being without oxygen. Just devastating, right? Again, in a country that did not have access to vaccination, right? And very highly populous. And so transmission, it was very easily transmitted. And so now, because of that, and because it's basically made the journey across the globe, we are now very concerned about that very highly transmissible virus not only getting around to more people, but potentially making people sicker and then hospitalized and then possibly dying, right? And so the other part of this too is that the reason why we want people to understand why these variants can be so dangerous is that we can also see something called breakthrough cases. And these breakthrough cases are in people who have been fully vaccinated and yet still end up testing positive for COVID-19. I will tell you, even though this is a possibility, most of the individuals who may become positive again typically will have a much milder case of infection. But again, it's still a problem, right? And now that everyone is running around maskless, it is something that is a concern. And so what I've been telling people, which is in kind with WHO's recommendation, is that if you are in an area with maybe lower levels of vaccination rates, because right now we're at around 48% fully immunized for the state, that it is probably within your best interest to wear masks in large gatherings where people have an unknown vaccine status or are likely to be unvaccinated.
And Dr.
That's really
Madison,
just
I just want to jump in really
you.
quick
Sorry.
because that mask piece is so important. And I'm going to go on a tangent, but I promise I'll be back. When this happened, I bought hundreds of masks. And then I decided, oh, let me buy some cute ones too. So I'm going to wear my mask. I don't care if there are no variants because they match my outfits. I'm sorry. Please go ahead.
Well, I've got some cute masks as well. So I hear you, I feel you, I affirm you, my dear. So snaps for you. And I thank you for that. Because again, when we take a look at benefits of mask wearing beyond just COVID-19, we saw almost a complete annihilation and eradication of influenza, right? So this past flu season, we saw a 99% reduction in flu cases. We had like a fraction of the number of hospitalizations related to influenza. So we know that mask wearing has other benefits other than just preventing COVID-19. We know that we saw fewer asthma exacerbations. So we saw fewer people going to the hospital sick with asthma symptoms because they were wearing masks. We're not transmitting these respiratory infections because we're keeping our respiratory droplets to ourselves, right? So again, I also want people to understand that masks are not political. It is literally just a public health protective tool in order to help you as well as those around you, right? So the mask not only protects the wearer, but it also protects everyone else as well, which is something that we didn't know at the beginning of this pandemic. And now we have data that bores that out and really, again, decrease in the amount of respiratory pathogens that we saw, a decrease in the amount of communicable illnesses, decrease in asthma exacerbations, COPD, smokers, right? Think about this. Think about all these people who probably quit smoking because it was inconvenient for them to smoke with a mask on, right? Like just things like that. Who would have ever thought that, hotels and casinos in Vegas would stop allowing smoking? And they did that during the pandemic because we knew that it was the safe and the right thing to do.
Yeah, that's so true. And the hand washing, I've been so grateful that people have learned how to wash their hands through this pandemic. The restrooms, and I'm just like, did the water touch you? Did you get wet? But now they know 20 seconds, and you can sometimes hear people humming the song just so that they are doing it long enough. So there are definitely a lot of benefits that have come that I hope we carry even beyond this pandemic. So for those that are wondering about a resurgence this fall, because as you mentioned with the flu, we saw such a great reduction. Do we think that we'll see COVID spike again, or just, put on your Miss Cleo hat and tell us the future?
Well, thank you for that. I've never been compared to Miss Cleo, so I can't even right now. Thank you for that. Here's the thing that I want people to understand. We are in much better shape than we were at the same time, even just last year at the same time, right? Because we saw, spikes associated with holidays, right? So Memorial Day, 4th of July, Labor Day, right? So we saw spikes, but the difference between then and now is how many people are vaccinated, right? We still aren't to that level that we call community immunity, or also known as herd immunity, but we are in a much better situation because, again, the virus needs a place to replicate. And if we limit the amount of places, AKA you and me, right, that the virus can replicate in because we're vaccinated, so we don't provide a home for them, then we decrease the potential chance for things like spikes and outbreaks. I will tell you, Nevada has requested resources from the Biden administration for what they call these very targeted strike teams. And that is to deal with some of these spikes that we're seeing right now. We've seen an increase in hospitalizations. We've seen an increase in the rise of cases. This is in the past couple months, this is the first time that our 7-day rolling average has actually gone up and not down. So again, we are trying to get out in front of it now. But I think the two biggest things that are really going to help us as a community is getting everyone who is eligible to be vaccinated. Because remember, we still have the under 12-year-old population that doesn't even have a vaccine eligible for them right now. And so we need to think about the children that aren't able to be vaccinated and being able to protect them. So that's why it's so important that we get everybody that is eligible vaccinated and getting both doses, because we know with this Delta variant, it's extremely important for people to get both doses because your risk for hospitalization is higher if you only get one dose versus two, okay? That we really emphasize going to where people are, meeting them where they're at. Again, we've got this Vax Nevada Days that's going on right now. You could win, anywhere from $1 million to, tickets to a show, right? So, there's lots of incentives right now for people to get vaccinated. But the main incentive that you should be thinking about is not just the fact that I could be getting a prize, but the prize of health, the prize of wellness, right? I think we as a public take for granted that we wake up with health and that that's not always guaranteed. And so we want to protect ourselves, but we also want to do this for the community good and really not just the community, but our most vulnerable, right? The measure of a society should be based on how we treat those that are less fortunate. And right now, we need to do a better job of making sure that those that are less fortunate, those that are vulnerable, those who suffer from health disparities and inequities, that those people are who we are targeting right now to get vaccinated and to be able to get access to health.
Thank you so much for that information and making it crystal clear for us. We are coming towards the end of our time together this morning, but you did mention the importance of that second dose for those two vaccines. Can you share why they're broken up into separate doses and how that process works?
Absolutely. So again, my Snapchat analogy. So the first time you see the picture, right, your immune system develops an immune response. But the second time it sees the picture, it really does a robust immune response. So basically, we use the first dose to prime the pump, and the second dose is your booster. And that's really what's going to take you to that over 90% efficacy that we see from both of the messenger RNA products. And again, just to reiterate, all three of the vaccine presentations that we have right now that are authorized in the United States are almost 100% effective at preventing hospitalization and death. And that's the thing that we really want people to understand, is that this is not a silver bullet, but we want you to not end up in the hospital and not die. And so even if you do end up catching COVID, if you're vaccinated, will have a much milder case. And that immunity that you have is probably going to last a lot longer than we thought it did.
So to piggyback on your social media piece on Instagram, can you tell I've been on Instagram lately? That's my thing now. But on Instagram, what you do is you post your picture or whatever you're doing, and then you post a story, but you cover up part of the story to say new post. So with this dual dose vaccine, what you're kind of doing is saying, hey, I've got something here, go actually like it. So prime that pump, and then now it's 90+% effective. I love this. This is amazing.
Absolutely. I love all the social media analogies, because our young people, we got to get our young people vaccinated. And as much as you think that this virus is something that we can just forget about, right? I saw all those people on the strip over the holiday weekend. As much as we want to be done with this virus is not done with us. So we need to do everything we can in order to end this pandemic, which means getting vaccinated. And if for some reason you still choose not to be vaccinated, please wear a mask and please wash your hands.
Dr. Christina Madison, the public health pharmacist, thank you so much for joining A Healthier Tomorrow. We're definitely going to have you back, but just so grateful for the information you shared and just making it real for us today.
Absolutely, my pleasure.
The A Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Everyone needs physical activity to stay healthy. Did you know that adults need at least 150 minutes of physical activity each week? Being active has so many benefits. It can boost mood, sharpen focus, reduce stress, help reduce chronic disease, and even improve your sleep. How can you increase your physical activity throughout the day? Visit gethealthyclarkcounty.org for tips on how you can be more physically active. That web address one more time is gethealthyclarkcounty.org. This has been A Healthier Tomorrow. I'm Will Rucker, and thank you for tuning in. Your health is the most important thing you have, and it is truly my honor to play a part in helping you to improve it. As I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And yes, what you do matters. So live compassionately. Join me again next month for A Healthier Tomorrow. Until then, be well.